Biomechanics of treadmill, jogging, and running. Team number 3. In order to have a better life, there are some things we can do to reach our physical or mental goals. Health, good diet, and exercise are the principal ones to reach a better life, and here we're going to show a way to practice the exercise. Motorized treadmill. Here are some benefits. It strengthens the legs. The strength increases due to the physical effort that you apply, either because you walk or run on a treadmill. Weight loss. In 30 minutes in a medium velocity, you could burn 140 calories. Weather doesn't matter. When you do exercise indoors, that doesn't matter if outside raining, doesn't matter the sun, nothing. Dynamic function. You can change the inclination to change from just walk to run or climb a mountain. You keep count. You can keep the kilometers and contabilize your success. And sleep better. Exercise gives you better dress, better mental health, and better mood. Also increase your energy from early in the morning, since this exercise helps your lungs and heart and oxygenates your body. Comparison between empty and overgrown running. Motorized treadmills are often used for research, clinical practice, and training purposes. In clinical settings, empty running is increasingly combined with video analysis to investigate running technique and inform footwear, orthotic, and gait retraining strategies for performance enhancement, injury prevention, and rehab. Several studies have reported difference in running biomechanics between empty and overgrown running. This difference may arise from a variety of aspects. A widely held belief is that empty running requires less propulsion as the belt moves and supporting leg under the body rather than the body moving over the supporting leg. An investigation showed that empty and overgrown running are theoretically similar when using a coordinate system that moves with the belt when belt speed is constant and air drag resistance is negligible. However, experimental studies have shown that the belt speed is not constant and instead decelerates at foot strike and accelerates at two off, thereby potentially altering running biomechanics. For faster speeds require higher stride frequencies, which increases air resistance during both treadmill and overgrown running. However, air resistance increases more with increasing in running speed during overgrown running, because the body moves through the air. And this could introduce biomechanical difference at higher running speeds. MC running biomechanics can also be affected by the comfort with this MC, like running, visual focus, belt dimension, and difference in perception, surface hardness, and mechanical treadmill model compared to overgrown running. Human gait. Human walking patterns are very important for medical diagnosis and orthopedics, pathological and aging evaluation, medical rehabilitation, and design of rehab system. Human prosthetics and human robots. Human gait is a cycle activity. The gait cycle is often defined as the period between initial contact of one foot with the ground and subsequent contact of the same foot, and consists of two major phases, stand phase and swing phase, as we see in the image. Stand phase is that portion of the gait cycle when the foot is in contact with the ground, and typically represents approximately 62% of the total normal adult walking gait cycle. 3-foot rockers, heel, ankle, and forefoot occurring during stand phase serve to control the forward fall of the body during normal ambulation. However, in pathological gait, one or more of these rockers may not be present. Swing phase is defined as the period when the foot no longer contacts the ground and the limb advances in preparation for subsequent foot contact. Swing phase occupies the remaining 38% of the gait cycle. As we can see in the image, the gait cycle is also characterized by 8 events. Stand phase consists of 5 events: initial contact, loading response, mid-stand, terminal stand, and pre-swing. And swing phase, on the other hand, consists of the other 3 events: initial swing, mid-swing, and terminal swing. Then we're gonna talk about pronation and supination. Well, pronation is the inward movement of the foot as it rolls to optimally distribute the force of impact on the ground as you run. With normal pronation, the foot rolls inward about 15%, comes in complete contact with the ground, and can support your body weight without any problem. Pronation is critical to proper shock absorption, and it helps you push off evenly from the bell on the foot at the end of the gait cycle. Although the pronation is a natural movement of the foot, the size and strength of the runner's arc can affect the foot's ability to roll, causing either supination, underpronation, or overpronation.
Supination. Well, supination in normal stride, your foot should roll inward a bit. That's called pronate, so that your weight is on the ball of your foot. Then you push off the big toe. If you supinate, most of your weight falls on the outside of your foot and you push off from your outer toes instead. Supination of the foot occurs when your weight rolls onto the outer edges of your feet. Another name of supination is underpronation. And this can lead to back and hip pain, stress on the knee, ankle injuries, inflammation of the sole called plantar fasciitis. Now I want to talk about some conditions that are very important. The first is genovarm. This is common among toddlers and usually resolves spontaneously by age 18 months. If it persists or becomes more severe, blood disease tibia bara should be suspected. And rickets and another metabolic bone disease should also be ruled out. Now, genovalgum is less common than genovarum, and even if severe, usually resolves spontaneously by age 9 years. Skeletal dyslipsia should be excluded. If marked deformities persist after age 10 years, surgical stapling of the medial distal femoral epiphysis is indicated. Plantar fasciitis. Plantar fasciitis is one of the most common orthopedic complaints. Your plantar fascia ligaments experience a lot of wear and tear in your daily life. Too much pressure on your feet can damage or tear the ligaments. The plantar fascia becomes inflamed, and inflammation causes heel pain and stiffness. Plantar fasciitis causes pain in the bottom of the heel. The plantar fascia is a thick, web-like ligament that connects your heel to the front of your foot. It acts as a shock absorber and supports the arch of your foot, helping you walk. Biology. Two subjects were analyzed with whom a video was recorded from the back on the treadmill. The video counted at least 2 gait cycles. Markers were placed in the sacrum, knees, and ankles. With the help of Kinovea software, the subjects were compared and know if the subject were pronator or supinator during the movement and according to the angles presented in the table. Another angles analyzed were the one formed with the lines drawn. One of them goes from the tibial tubercle to the midline of the patella, and the other is the same way from the middle line of the patella, in this case directed towards to the anterior superior iliac spine. Results for subject 1. According to the table, this subject presents various conditions and in the right foot, and in the left foot is normal. When the subject is running, this presents pronation. According to the angles for the subject number 2, a value of 13 was obtained from both the left and the right sides. This can be visualized in the photos. This subject presents supination for a normal gait and pronation in the case of running. Then it can be seen that in the right foot the subject presents an angle of 169 degrees, which is valgus, and in the left foot is also valgus. Conclusion. The displacement of a person could be something that it is considered as simple. It is something that people usually do in their day-to-day, but as in all parts of the body, different pathologies usually appear. In this case, 2 subjects were analyzed to see if they present some of the most common. Such are the pronation and supination of the feet, which leads to a flat foot, or a too pronounced plantar arch, or it is also the case of the arch form with both legs. This can be a disease of genus varus or genus valgus. And these were our references, and thank you too much for watching the video and subscribe.